She had been keeping a log for 14 months. A small green notebook, entries every morning before breakfast, the kind of discipline most people promise themselves and almost nobody actually keeps. When her son brought her in, he handed me the notebook the way people hand a doctor, something they think will help. I opened it and saw the same pattern on almost every page. 164 over 72, 160 over 70, 166 over 68. And in the margins, in her own handwriting, the same note written in different ways across 14 months. The bottom number looks fine. The doctor said, watch it. Feeling okay. Her name was Gloria. She was 69 years old, and by the time she arrived in my emergency department, the left side of her face had been drooping for 40 minutes. The bottom number had looked fine every single morning for 14 months. The top number had been quietly destroying her blood vessels, one beat at a time, the entire time. If you are over 60 and you check your blood pressure at home, there is a specific belief about which number matters most that has been passed from doctor to patient for decades. And in seniors, that belief is quietly sending people to emergency departments all over the country. I am going to tell you which number is actually most dangerous, why the answer changes depending on your age, and the two patterns that fool even the most careful, attentive seniors, because one of them looks like success, and the other one has almost no warning at all. My name is Miles. I have spent the last 13 years working emergency medicine, and blood pressure is one of those conversations I end up having in hallways, usually after the number that should have mattered had already been doing its damage quietly for months. Before we go further, I want to be direct about something. I am not telling you your doctor is wrong, and I am not telling you to stop checking your numbers. I am telling you what checking the wrong number, or reading the right number the wrong way, actually looks like from where I stand, which is on the receiving end of what happens when that goes on too long. If this is the kind of thing nobody has ever walked you through, clearly subscribe right now, because handing you the complete picture before it becomes an emergency is the only reason I built this channel. Here is the answer I promised you, and I'm giving it to you now, rather than making you wait for it. After 60, the top number, the systolic, is almost always the stronger long-term warning signal. Not the bottom number, not the average of the two, the top one. And if your doctor is spending more time talking about your diastolic than your systolic, and you are over 60, you are not getting the full picture, and the reason why has everything to do with what aging does to your arteries. Your arteries are not rigid pipes. In your 40s, they behave like the walls of a trauma bay when the doors swing open. They absorb the force, flex with the pressure, and reset. With age, that give disappears. Picture the same wall built out of concrete instead. When your heart pumps now, the pressure wave hits something that no longer flexes at all. The force travels straight through, uncushioned, and the top number climbs. The bottom number, which reflects the pressure while your heart is resting between beats, may stay flat or even drift lower, because rigid walls cannot hold pressure the way elastic ones can. This pattern, a rising top number with a normal or even low bottom number, is so common in seniors that it has its own clinical name: isolated systolic hypertension. It is the most common form of high blood pressure in people over 60. It is also, in my experience, the most consistently dismissed, because the bottom number looks fine. Gloria's notebook had been showing me the truth the entire time. The column she had been watching, the one that looked reassuring every single morning, was the column that had nothing to tell her. There is one more thing about that rising top number that I want you to understand before we go further, because it shows up on monitors every day, and almost nobody knows what to make of it. Look at the gap between your two numbers. A healthy pulse pressure, the difference between your top and bottom reading, sits around 40 points at rest. When that gap starts pushing past 60, past 70, past 100, the widening distance is not just two numbers drifting apart. It is your artery walls telling you they have lost so much elasticity that the heart pumps and nothing cushions the force going out, and nothing absorbs it coming back. The top number climbs because the walls cannot flex. The bottom number drifts lower because stiff walls cannot hold pressure between beats. The gap between them becomes a map of the damage accumulating inside, written in plain numbers on a device sitting on your kitchen counter, and almost nobody has ever been told how to read it. If I stopped there, I would be leaving you with a picture that is still dangerously incomplete. Because the top number being the long-term signal is not the whole story. There is a second pattern that does not unfold over months. It can become life-threatening within the hour. And there is a third pattern, the most deceptive of all, that hides behind numbers that look almost beautiful on paper. Tell me in the comments which number you have been watching most closely on your own monitor, the top or the bottom, because I want to know how many people are reading the same column Gloria was, and I read every single comment. This channel exists to give you the conversation that actually accounts for what your body is doing, not the one that fits inside 12 minutes. So if you have not subscribed yet, now is the time. I want to tell you about Raymond, 61, a former engineer, not a man who rattled easily or made decisions without data. He woke one morning with a headache behind both eyes, unlike anything he could name. Different in a way he could feel, but not describe. He sat at the kitchen table, checked his blood pressure twice, and got readings of 192 over 118, then 188 over 119. Then his vision blurred in his right eye. He told me later he sat there for almost 8 minutes, telling himself it would come down. It always did. What Raymond was sitting inside was a hypertensive emergency, a reading above 180 on top or above 120 on the bottom, combined with symptoms. Chest pain, shortness of breath, sudden weakness or numbness on one side, trouble speaking, vision changes, a severe headache that feels wrong in a way you cannot name. Any of those symptoms alongside numbers in that range is not a wait-and-see situation. I am telling you this directly. I have seen what happens when patients reason their way through those 8 minutes. The outcomes can be permanent. Raymond made it because something in him picked up the phone. That instinct was the difference, not the data. A number that high with any of those symptoms is the only time I want you to stop reading and start moving. Now, I need to tell you something that almost no blood pressure video ever says. And I have started saying it publicly because seniors deserve to hear it. The push to lower blood pressure numbers is correct in principle. In older patients, it has quietly created a second crisis that does not get discussed loudly enough. Walter was 78. He took every medication on schedule, kept every appointment, and his numbers on paper looked like a victory. 124 over 54. 122 over 56. 126 over 52. His previous doctor had sent him home with a thumbs up. But Walter was gripping the bathroom wall every morning in the shower. He had started trailing his hand along the hallway furniture when he walked, not because his legs were weak, but because the floor felt unreliable. His family assumed it was age. The coronary arteries, the ones that feed the heart muscle itself, receive most of their blood supply during diastole, the pause between heartbeats. When the heart is resting, when the bottom number drops too low, the heart may not be getting what it needs between each beat. In a 78-year-old with arteries that have already stiffened and narrowed, a diastolic number sitting consistently below 60, especially on blood pressure medication, is not a victory. It is a discharge summary that looks clean and an ambulance call waiting to happen. I adjusted Walter's medications carefully over several weeks. His grip on the hallway furniture relaxed. He told me on his next visit that he had forgotten what it felt like to just walk across a room. The goal of blood pressure management is never to win a number contest. The goal is to protect the heart, protect the brain, and preserve the safety and independence of the life you are actually living. In seniors over 60, lower is not always better. Safer is always better. Those two things are not the same. So here is the complete picture, the one I want you to carry to your next appointment and every reading after it. A top number sitting persistently above 140, even with a calm bottom number, deserves serious attention. Do not let a reassuring bottom number silence a climbing top number. That is the lesson Gloria's notebook spent 14 months trying to teach her. A top number above 180 or a bottom number above 120, combined with any symptom, is a potential emergency. You do not wait. You do not check again in 5 minutes. You call for help. A bottom number falling consistently below 60 in a senior on blood pressure medication, especially with dizziness, unsteadiness, or a grip that has started looking for walls, is a warning moving in the opposite direction. Lower got confused with better, and that confusion has a cost. Your blood pressure monitor is not giving you two numbers. It is giving you a clinical picture, a pattern that tells you whether your arteries are stiffening, whether your heart is under strain, whether your treatment has gone too far, and whether your body is moving toward a crisis or quietly away from one. The seniors, who stay safest, are not the ones who track the most readings. They're the ones who understand what the pattern means well enough to know when to act on it. Gloria survived her stroke. She lost some function on her left side that she spent the last year working hard to rebuild. She gave me permission to tell her story because she said the same thing to me that I want to say to you now. The information was never missing. It was in that notebook every single morning for 14 months. She was simply reading the wrong column. If this video changed the way you look at your own monitor, share it with one person over 60 who still believes that a calm bottom number means they are safe. I'm Dr. Miles. That belief is sitting in millions of homes right now, written in the margins of notebooks, just like Gloria's. Subscribe, and every time you check those two numbers from now on, you will already know which story each one is actually trying to tell you. Thanks for watching.